Hello, I'm Dr. Katia Batista, a specialist psychiatrist, and today I want to share a very important topic that touches many lives: depression. Let's start with a real life example. You may have heard about celebrities like Robin Williams, a talented actor and comedian who made millions of people laugh, yet silently struggling with depression. His story reminds us that depression doesn't always look like sadness on the outside and can affect anyone, even those one who seem happy and successful. It shows why it's so important to recognize the signs and understand the difference between sadness and a real mental illness. Sadness is a natural emotional response to life's challenges. For example, losing a loved one, facing disappointment, or dealing with hardship. In sadness, the emotional pain is usually proportional to the situation, and even though we feel hurt, we can still continue with our daily routines, work, and social life. Over time, sadness tends to fade as we adapt and heal. Depression, however, is totally different. It can occur even without a clear reason, or the emotional response is excessive compared to the situation that the patient is going through. Depression interferes with daily functioning, work, relationships, self care, and often feels overwhelming and endless. When sadness becomes deep, persistent, and disabling, it's no longer just sadness, it becomes a medical condition that needs attention. Is what we will is what we will talk in this video. Depression is a serious medical illness that affects how you feel, how you think, and how you behave. It's not a sign of weakness or something you can just snap out of. The impact of depression is in every part of your life: your work, your relationships, your health, and even your ability to hope for the future. Untreated depression can also lead to more severe consequences, including suicidal thoughts. Some signs that might indicate depression include persistent feelings of sadness, emptiness, or hopeless, loss of interest or pleasure in activity once enjoyed, changes in appetite, either eating too much or too little, sleeping too much or too little, lack of energy or constant fatigue, feelings of worthlessness, even sometimes there is inappropriate guilt, difficulty concentrating or making decisions, thoughts of death or suicide. If these symptoms persist for more than 2 weeks, it's really important to seek professional help. The good news is depression is treatable. As a psychiatrist, I often recommend a personalized combination of the psychotherapy with medication. Several types of psychotherapies have proven effective in treating depression. Some of the most commonly used are cognitive behavioral therapy, CBT. This is one of the most widely used. Is focused on identifying and changing negative thought patterns and behaviors that contribute to depression. The main goals of this particular psychotherapies are to help patients recognize distorted thinking, challenge unhelpful belief, and develop healthier coping strategies. Also, interpersonal therapy, IPT. IPT helps patients improve their relationship with others, addressing issues such as grief, role transitions, and conflicts that can trigger or worsen depressive episodes. Psychodynamic therapy. This approach really explores unconscious patterns rooted in early life experiences. It aims to help individuals understand how these patterns impact their current emotion and relationships, providing insight that promotes emotional healing. Like I said, this combined with medication like antidepressants. Antidepressants really can help balance brain chemicals and reduce symptoms. The patient can practice lifestyle interventions like regular exercises, healthy eating, structured sleep patterns, and staying socially connected can significantly help. Advanced treatments for more severe cases options there are options like transcranial magnetic stimulation or electroconvulsive therapy are available and effective. Alongside treatment, you can support your healing by maintaining a consistent daily routine, engaging in regular physical activity, practicing mindfulness or meditation. You can also set small goals, reaching out to trusted friends and family for support. I would like to tell you a final message. If you are struggling with depression, remember you are not alone. Reaching out for help is a brave and powerful step toward recovery. Depression may be part of your story, but it doesn't define who you are. There is hope, there is healing. Thank you for being here today. And if this video help you, please share it with others who might need this message. If you like it, please subscribe here so we can continue discuss about topics of mental health. Thank you.